Compared to about 3 weeks ago, the number of COVID-19 tests being done at the Augustine Medical Lab has dropped by about 20%. But interestingly enough, the positivity rate remains the same. And this has Dr. Shari Ramcharan, who's the Deputy Director of the lab, concerned.
We're still getting a positive rate of about 15 to 20%, I would say, which is actually still high, because that's what it was a couple of weeks ago too. So the volume has gone down, but the positives are actually quite high. You know, we would want to see the positive rate being significantly lower with the volume going down like this, but that's not the case.
The lab, which started variant identification 3 weeks ago, continues to see a high number of positive cases with the P1 variant, also known as the Brazilian variant.
We've identified quite a lot of it in the last 3 weeks. Exact number, I'm not going to give it, but we have identified quite an amount, and that information we would keep to the CMO's office, updated.
Dr. Ramcharan says the lab is mandated to report positive cases to the Health Ministry and not for variant testing, but still submits a report to the CMO. She notes that variant identification has not been a burden on the lab and takes little time to conduct. Dr. Ramcharan adds that they have received numerous requests from past COVID-19 positive people for their sample to undergo variant testing.
A lot of them who tested positive last year or a couple months ago call us and say, hey, can you do the variant for me? We can't. Especially if you were positive, those samples have already gone to CAFA since the day you were positive. So we no longer have access to those samples. And
the St. Augustine lab has several testing sites and receives samples sent by doctors as well as home visits for persons in isolation. Their compilation of positive cases are included in the Ministry of Health's daily updates for COVID-19. Sunil Lalla, TTT News.